So I actually wanted to share a bit of a reflection yesterday as well. Just to remind folks again that the conference here is actually a gathering for miyomahcihowin. The miyomahcihowin really is physical, mental, and emotional, spiritual well-being. So we have a number of new folks that are here today, so I just wanted to remind folks. And also, just for some housekeeping, you actually all have an evaluation form, so I encourage folks to please provide your input over the next 2 days, or for the last 2 days, yesterday and today, in terms of your feedback. And then also to remind folks that the gathering for miyomahcihowin really is around relationships. It's about engagement, collaboration, and finding ways to think innovatively, finding ways to look at incorporating traditional practice. We heard from Dr. Makokis yesterday giving us a lot of good ideas. We heard a lot of ideas from our speakers. The importance of integrating and incorporating traditional knowledge, our elders, building that into your programs and learning from our elders, working with our First Nation Métis leadership, building on what you've already have, but not forgetting the young people. Michael Linklater talked about working with our young people, sharing his own personal journey. We had a lot of fantastic speakers coming in here yesterday, sharing their best practice here in Saskatchewan. And when you look at the work that's being done within Saskatchewan, folks are looking at us at an international level and wanting to adopt what we're doing here. So it's a great opportunity to learn, to incorporate, to build those relationships. So I just wanted to share a little bit and reflect on that. And I'll turn it over back to Lois.
Thanks, Gabe. My students will tell you that you don't ever give me a microphone because I don't give it up easily. So I want to reflect on Joanne's reflections. I am a proud registered nurse of 43 years, and I recognize the important role that nurses play as the frontline point of care individuals that many Indigenous people deal with. And like all of us, I know that those relationships are not always positive. And so for me, it is very powerful to hear my profession talking about reconciliation and how it wants to learn to come together to learn how to walk forward in a good way with our Indigenous colleagues. And that's, I think, what we're here about today and yesterday. It's about learning from each other what we can contribute to miyomahcihowin, to actually living healthily, to live well. And so I thank Joanne for her comments, and I hope that that our spirit of inclusion and collaboration continues today. I was very touched last night at the round dance when one of the speakers said to the gathering, there are many settler allies in this group, and this may be their first time being at such a gathering as this. Please extend your hand to them. And those kinds of extensions of hands in both ways are very, very powerful. So I would ask us to continue to extending our hands to each other through the course of the day. I want to thank the Pharmacy Association of Saskatchewan for their investment in this conference. They sponsored the breakfast that you had this morning, so I'd very much like to thank them. And I'd very much like to thank Dr. Kish Wasan, who was here yesterday. I don't think he's here today, but Kish was the one who actually greased the wheels for us going to the Pharmacy Association. So it's all about relationships, you know, it really is. So thank you very much, Kish. So we're going to launch into our day today. I think we have another exciting day. I know we have another exciting day. And so we're going to start with a presentation by Dr. JoLee Sasakamoose, who's going to come up and talk with us about promising approaches to wellness. So I'd ask her to come forward, and while she's coming forward, I'll tell you a little bit about her. Jolie is an Anishinaabe from, I won't even pretend to mutilate the name of your First Nation, so I'll get you to share that with me. She's an assistant professor in educational psychology and counseling at the University of Regina, and she serves as the founding director of the Health Advocacy and Research Training Program that works in partnership with the Fred Sasakamoose Indigenous Youth Leadership and Wellness Program, a youth partnership with a youth sport, recreation, and health camp at the University of Regina. It would help if I could read. She serves as research affiliate with the Indigenous Peoples Health Research Centre and a methodologist with the Saskatchewan Centre for Patient-Centered Research, and I believe she's actually had an appointment since this bio was written, and I would ask her to tell us about that. So I'm going to turn it over to Jolie and ask her to, do you want to sit, or would you, because we can, okay, come on along. Welcome.
Good morning. My name is JoLee Sasakamoose. I'm from Chiging First Nation in Ontario and Sheboygan First Nation in Michigan. I grew up mostly straddling the border, knowing that after the second Bush regime stole the election that I would end up in Canada on a permanent basis. So that's how I've come to be. I've worked in Northern Ontario, Northern Manitoba, Northern Saskatchewan, so I have a lot of affiliation with Northern communities, a lot of respect and work that I've done there. Today's talk is quite interesting for me because it's my first time as the director of the Indigenous Peoples Health Research Institute. Thank you. I want to acknowledge, as difficult as it may be, that I am the first director appointed after our deceased director, Dr. Joanna Piskanu, our very beloved director and a mentor of mine. So it's been a gap for 2 years that we've not had leadership in the role of the director, and I've been appointed as of January. I knew I was coming in around June of last year, but I asked for time to fast and go to our Sundance ceremonies and ask for elder guidance because this is a big role to take on. And while Joanne had mentioned it to me a couple years prior to her passing that I might want to start thinking about my career and thinking about a role like this, her death sort of pushed that step into this place a lot faster. So one of the things that I've noticed since becoming the official director as of January is the demand on this role. The number of talks I'm being asked to present, the number of requests that we're being asked from community, especially after the Colton Bushy and Tina Fontaine cases. Our communities went into trauma and stress, asking for help and support. And so one of the things that we've been trying to do with our very small staff is try to figure out where to strategically place IPHRC in this conversation provincially. It's an exciting time in the province. Some of you may not feel that way, especially if you work for the health regions or INAC or any of the organizations that are in flux and under stress right now because of the changes. But for First Nations people and Indigenous people and Métis people, that's all we ever do is watch the collapse of our governments and the collapse of our infrastructures. We don't ever really rely on them. We're not dependent on these false infrastructures because we always do one thing, and that's take care of our people. No matter where they are, what they do, we go back to taking care of our people. And as someone who's worked in the addictions field for over 25 years, one of the things that I've noticed is sort of this dichotomy between addicts and non-addicts. And so there's that sort of hard line, if they're an addict and they're not behaving, you kick them out of the family, you kick them out of your life, you alienate them, you isolate them, you don't want their bad behavior around. But from a First Nations and Métis perspective, those are our family members. So regardless of whether or not they're addicted or in active addiction, they still need to come to the table at the holidays. They still need to be the brothers to us, the sisters to us, the cousins, the uncles, the aunties to our family. And so that's one of the things that I see as a major difference in how we approach our health and well-being is that we always take care of our people. So one of the things that I've been asked to do in the conversation is to talk about promising practices. But I also want to address some key issues because one of the things that you'll find with me when I'm asked to speak is I go for one thing, and that's the truth. I am a little frustrated with the conversation at some of the places that we inhabit because we talk so much about reconciliation, over-talk it actually, overuse the word, but we don't ever discuss the word truth before it. And for me, the word truth is so important because if you don't have our truth, we'll never get to reconciliation. And sometimes the truth is really hard to look at. One of the things my very good friend, now retired Dr. Shawneen Pete always says is we've all been structurally denied the opportunity to learn the history and the truth of which we are all shared with. So I look at this as a shared responsibility as we move forward into reconciliation and whatever that looks like. One of the reasons I think it's an exciting time in the province is because First Nations and Métis peoples, while there are all these collapses going on and restructurings of infrastructures, we've been behind the scenes working our tails off for years, and we actually provincially are quite well organized and ready to move ahead. So while all these infrastructures are failing us, we have systems and structures ready to go and in place, and I'm going to talk to you about those today. What is different about Indigenous wellness maybe from the non-Indigenous model is that it's the mental, emotional, physical, and spiritual. And I often say that the spiritual is achieved through the process of going to the mental, the emotional, and the physical. That's where that spiritual element lies. So I'd like to talk to you about the cultural responsiveness framework. And before I get into it, I'll tell you a little bit of the history. And I'm not going to follow the slides exactly because the slides about the history come in later. But there was a memorandum of understanding between Health Canada, First Nations, Métis and Inuit Health Branch, the Federation of Sovereign Indigenous Nations, and the Ministry of Health. And that was in 2008. And then after that MOU came into place, FSIN, the Federation, did 3 years of in-depth consultation. And that consultation included going to ceremonies, working with elders, going to powwows, going to youth events. And it took 3 years for them to engage, to ask the question of what First Nations and Métis people wanted to see in their health systems and in their health and well-being. And out of that, they birthed the culturally responsive framework, which is available on the FSIN website. It's a very lay language, very easy, digestible tool that people can use to help implement cultural responsiveness into their programs and procedures and policies. It really can work at all levels. But one of the things that happened 2 years ago was Chief Reg Belrose of Muskogean First Nation contacted me and asked me to join his team to help develop the first family-based healing and wellness center on his First Nation. Now, Muskogean's an interesting location because it has what I believe it's either the last standing or one of the last standing residential schools left in Canada. And so while it's a small community of about 370 people, the devastation and the emaciation of the community because of that residential school being on the reserve is profound, and it trickles throughout the whole region because so many people from other communities came into that residential school. So with the chief, over the last 2 years, we've done some engagement and some consultation. We worked with community. We've trained some community members on being co-researchers. I work with the Saskatchewan Centre for Patient-Oriented Research. You might hear this term patient-engaged research a lot. It's not a new thing. It's new to them, but it's not a new thing to First Nations and Métis peoples. We've been doing community-engaged research our whole lives. I think that's the only way we know how to do research. So we engaged with the community, and we learned a lot of things over the last couple of years, and now we're moving towards getting funding to build that center. One of the things the chief had a lot of foresight about was that culturally responsive framework, and he insisted that that framework be the model for which the health and wellness center was being built. But interestingly enough, you can't just take a framework from an academic mind. Remember, I'm an academic. You can't just take a framework and build a center off it. We need theoretical models to operate from. So it took me and 2 other Indigenous scholars a year of writing and developing theory. I'd never written a theory in my life. I'm not sure that I'll ever do it again. But we birthed the theory out of the culture responsive framework. That's the article. It's called Miyomahcihowin, Developing Indigenous Culture Responsive Theory. And I didn't have any expectations when we co-authored the article with people from FSIN and the elders. I had no expectations. I just really was doing what the chief asked, which is usually what First Nations and Métis researchers do. You do what the community asks you to do. You don't really design your own research and go off and do it. I know it's a shock to a lot of researchers, being told what to do, because when you're a PhD or a physician and you're doing research, you have this elite status and you're the know-it-all. But I think that's the paradigm shift for researchers and people who want to go into First Nations communities, is you're actually not the expert, you're the facilitator. And in my opinion, you're the person who does the empowerment of the community so that eventually when you leave, they can take over it on their own. So we had birthed this theory so that we would actually have this theoretical model to use. And ironically, that was published in the International Indigenous Policy Journal, and it is the number 5 top most downloaded journal article since October 11th of 2017. It's been downloaded over 500 times in about 20 different countries, in a really concentrated area in Germany. I'm quite fascinated to why so many people in Germany are interested in this model. It was so interesting because you can look at your diagnostics of where your articles were downloaded, and it's just fascinating, and a huge component out of Saskatoon. So that made me really happy to see our own people might be using this framework. So just a little note about that. And then the other thing that I think is super important, and I've been asked to talk about lately, besides the CRF, is OCAP. Now, OCAP's been around for a while. I assumed everyone knew what OCAP was. I thought even our own communities knew what OCAP was. We certainly say it enough. But as I started digging in and started doing my own research and found that I had my own OCAP violations from time to time without even noticing it or understanding it, or sometimes a physician might say, hey, you know, I've got this clinic in the city and I've got people from community coming out to go to my clinic. If I bring a file from the community into my clinic, am I an OCAP violation? That's a really honest question, and it's one I don't necessarily know we have the answer to. So a third area that is not in the slides today that I want to talk about, but just to show you how organized First Nations and Métis people are in this province, is that there's discussions underway about developing a First Nations Information and Governance Center. How many people in here knew that? Very few people. That is a huge undertaking. It's a huge endeavor, but we are close to establishing one. So this would be a benchmark for us. Other provinces have one, and without having one, I just spoke recently at the FSIN engagement about this, without having one, we really don't have any protections in place. If there's an OCAP violation going on, what can you do about it? Not too much. How do you enact protections? So this is another area that I speak to, and I try to Martin Paul suggested that we start using the term OCAP empowerment for First Nations communities and Métis communities, that we start using that terminology. I used to say, well, I want to get First Nations, Métis communities OCAP compliant to the extent that they want to be. And the language that I'm now being told to use is that they all want full empowerment. So those are things that we should think about as we move forward. It's not so much now whether or not they have capacity or don't have capacity. If you're a researcher going into community, it is our responsibility as researchers to assess where they are and their level of OCAP abilities, and to make sure that when we leave that community, say we're in a 3 to 5 year project, at the end of that project we have gotten them to the ability of OCAP ownership and compliance and empowerment to the extent that we can. And that is a skill that no researcher has, because it's a new process. And so that's where ICRTSO is coming in. We're trying to address that gap. We're just now looking at possibly hiring a staff person who could come in and help us assess where communities are with their level of OCAP competency and empowerment. So why is the CRF or the ICRT? So the ICRT is what we called the theory. We called it the Indigenous Cultural Responsiveness Theory, or the Culture Responsive Framework. Why is this important? First of all, I think it's important because it actually used number 19 of UNDRIP, the duty to consult, the United Nations Declaration on the Rights of Indigenous Peoples. It actually used the duty to consult. And consulted through ceremony, through relationship, through 3 years. So a lot of times people say, oh, we've engaged First Nations people, Indigenous people. How have you done that? I'll give you an example of how the government sometimes thinks they do engagement. The Treasury Board of Canada contacted me last year and said, we're going to pay for you to fly out to Ottawa. We want to have your input on, we heard you talk about OCAP a lot. We want your input. Fly me out to Ottawa, sitting there with a bunch of Indians, about 2 people from every province except Saskatchewan. I was the only one. And they said, we're doing our duty to consult. And I said, how? Because I'm from Ontario, my chief doesn't know I'm here, and I'm not a Saskatchewan Indian, and I don't represent the voice of Saskatchewan, so we are definitely not your duty to consult. And I looked around that room, and about $107,000 that was spent to bring us all together under this illusion of a duty to consult. So those are the types of things that when you think you're doing the duty to consult, you just might want to look around and start checking with the communities around you and see if they think you're doing the duty to consult. I'll give you another example. In my own faculty of education about 1.5 years, 2 years ago, our former dean decided to create a position called a chair in reconciliation education, and then wondered why no Indigenous scholars applied for it. Think about that for a moment. Why would no Indigenous scholars apply for a chair in reconciliation education? Because that's not our job to reconcile. We have no reconciling to do. That's not for us to do. So I begged our faculty, at least put the word truth in it. You might get someone interested in coming in who's Indigenous if that's what you're trying to attract. Those are the types of things that I mean when I say duty to consult. We have 5 Indigenous scholars working at the University of Regina. 5. Over the last 8 years, the number has stayed at 5. If you lose one, you get one. If you lose 2, you get one. always 5. So I have this little joke that I want to wear a t-shirt that says 1 of 5, because it's a very frustrating number to be at. It's very, I mean, people knock on my door, can you teach me how to offer tobacco to an elder? Can you come speak to my art history class about Indigenous art? By the way, I'm not an Indigenous artist at all. So those are the types of things that when you're 1 of 5, put the pressure on you to an enormous extent. So I would say that the culturally responsive framework in the province of Saskatchewan does speak for Indigenous people, because Indigenous people have empowered it to speak for themselves. There are 3 basic tenets of the strategic directions of the ICRT, and that is first to restore First Nations community-based health and wellness systems. And that sounds easy enough, but when you think about the health centers that you work with, when you think about the hospitals that you have, do you see Indigenous well-being going on? Do you see the opportunity to smudge? Do you see the opportunity to ask for traditional medicines there? And you may see it. For example, when I birthed my son in the Regina Hospital, there was a ceremony room there. And because I ended up in C-section, we couldn't do the water birth that I had planned with the midwife. All that fell apart. So when I ended up in C-section, we couldn't even bring the rattle into the birthing room because the rattle's not sanitary. So I thought, no big deal. We'll just go down to that ceremony room after. Do you know how hard it was to get to that ceremony room? They acted like we were stealing our own child off the ward. We could not do it. And the only reason I was able to get into that ceremony room is because I had actually had a midwife of record, and the midwife allowed it, but the physician himself didn't. So even if we have these spaces and places in our own centers and in our own units, if we can't access them as Indigenous people, what is the point? So I caution you to be careful about when you have these places and spaces in your centers or in your units or in your health regions or in your hospitals if First Nations and Métis people can't access them. The second part of the ICRT or the CRF is to establish a middle ground for engagement between mainstream and First Nations systems and worldviews, establishing a mutually beneficial coexistence and the foundational stage for reconciliation. I'm going to spend quite a bit of time talking on this in a little bit, but I think this is so crucial. To me, this is somewhat of a middle ground space, except I'm up here and you're down there. But it's the conversation. It's coming into the room knowing that you're going to put aside your preconceived notions and ideas, and you're going to sit down with two kinds of groups, and you're going to come to a middle ground space. Now, from an Indigenous perspective, in this middle ground space, and if you know the work of Willie Ermine, this is that ethical space, that's that kind of concept. And it's in that middle ground that concept of two-eyed seeing comes in. Now, if you don't know these concepts that I'm talking about and you want to work with Indigenous peoples, my recommendation is you get my article and you start to get comfortable with terms like two-eyed seeing, middle ground, ethical space, because these are common everyday terms that Indigenous people use. They may have come from the language first, so they may not be using that modern day two-eyed seeing stuff, but we know what this stuff is. When I go into a room with Indigenous people, I don't have to define these or explain these terms. Two-eyed seeing basically talks about this concept of using with one eye that Indigenous lens to see the culture and the aspects of the culture that work for us, work for Indigenous people, and then with that other eye, that Western lens, that evidence-based practices that work. So we don't just say everything Western, we say evidence-based practices that work. So you have with that one eye that a Western lens, the other eye the Indigenous lens, and then you harmonize the two together. And I like that word harmonize because what it does is we only take what works, right? We only use what works. If it doesn't work, it doesn't belong there, and it doesn't belong in the middle ground. So I use the word harmonize a lot. That middle ground place is a sacred space. When you're in the middle ground, you often will enact the community-based protocols. So this is why it's very locally adaptable. I have not been challenged on it yet, but even though we say it was created by and for First Nations and Métis people in Saskatchewan, it is locally adaptable because of that middle ground space. When you're in the middle ground, you position Indigenous ways of knowing based upon whoever's in front of you. So if it's a Christian community and they want to open in a Christian prayer, that's what they do because that's their choice. That's why this theoretical model is so malleable and adaptable. And then finally, the third tenet is to transform mainstream service delivery to become culturally responsive by guiding the research that continuously improves Indigenous well-being. It's pretty straightforward, but the reality of what the Indigenous people in consultation talk about in the CRF itself is that in order to transform mainstream service delivery, that is not Indigenous people's work. It is actually changing the attitudes, the beliefs, the policies, and the procedures of our health systems, of our health regions, and of our people who work there. That's mostly non-Indigenous people. So those are the types of things that we have challenged before us, is how do we become culturally responsive health practitioners in these places? And I expand that beyond health. I expand it to education. I expand it to justice. I expand it to everything, because to me, we all need to be culturally responsive practitioners. And the other thing that I'll just say about this as well, it's called the Indigenous Cultural Responsiveness Theory. I've been getting a lot of contact from international communities, new immigrants, new refugees coming in. Our model is very applicable for that too. It's culturally responsive. It doesn't have to be Indigenous. It doesn't have to be First Nations. It doesn't have to be anybody. These are human values that Indigenous culture has always espoused, human values that cross any culture. So if you just enact this, you will be more culturally responsive across the board. So why do we need our own theoretical framework? Well, too often indicators of community wellness actually measure the absence of something negative, disease usually. So you're disease-free, you're healthy. But when we did a study recently, about 2 years ago with First Nations youth, they were clear that you can look healthy, you could be physically fit, but maybe you drink too much on the side, or maybe you're emotionally unwell. So they already identified at a young age that they knew that there was more to health than just the absence of disease. The other reason we need our own framework is because when we track, especially with the government, when they ask us to track our data, they often ask us to track our deficit data. How many suicides, how many deaths, how many this, how many heart attacks. We never track the strengths. We don't track the number of graduates. We don't track the number of scholarships. We have to start tracking our own resiliency, and we must allow First Nations and Métis peoples to identify what those wellness measures are. We can't just go assume that we know what they're going to be, and that's a very long process. I've been contacted by one of the former health regions a couple years ago to help them develop asset-based measures, but they can't do it without consultation with community. It's just not right to do. So I hope everyone kind of understands what I mean by that. So one of the things that ICRT would ask is, what processes and protocols do you need to engage in order to open dialogue? I mean, I don't know how many people actually work in First Nations and Métis communities, but often even when I go out to a community, most I might do for the first visit is have tea. I've used to work in Manitoba at the University College of the North in the PA, and my job was to go into the 26, well, it's actually more than that, remote communities, like Brochet and Lac Brochet, which were Dene communities. I'd fly in, my white-looking face, don't speak the language, get off the plane, no one's there to greet me, and I've got to figure out how to communicate with them and get their information on what they want in an education program at the University College of the North. Not an easy task to do. So sometimes you might go into a community 3, 4, 5, 6 times. It might take a year. I just talked to one of my research teams today who said that they've been out 6, 7 times and they're still not ready to just start talking about the research sharing agreement because it's a little daunting. So when you want to engage in Indigenous research, and in particular in Indigenous practices, you have to be aware that this will take a lot of time. And if you don't have that kind of time, it's probably not worth your while to engage in it. So one of the ththings that we do at IPHRC is we intake, or we help support grant writers. Right now, unfortunately, is mostly non-Indigenous, but as we look at those grants, some will say, you know, I'm a physician, I want to do research with Indigenous communities, but I don't know any. Can you help build those relationships? Maybe, maybe not. Can you build those relationships? Because if I build those relationships and you go and do the work and then you're done and I leave, how are those relationships maintained? I think one of the things that's confusing as well is this idea of relationship building doesn't last for the duration of your project. It doesn't last for the 2 years you have the grant, or the 1 year you're doing the research, or the 1 year that you're doing the project. You're supposed to build relationships for the lifetime. This is a small province. There's no reason why, if a physician's in a community for the next 10 years, that there aren't relationships with that physician, that they don't know your entire family. That's the way we operate. We know everybody in our communities. Like I said earlier, we always take care of our people. What does the community need? What strengths does it have already? This question I hardly ever see asked. What assets does the community have? Try some asset mapping. Ask the community to tell you. They know their strengths. They also know what they need to heal and get well. And people often assume that we as Indigenous people don't have that kind of knowledge. I get shocked sometimes. I get invited to co-present or co-author or co-do something, and then I get drafts of this stuff. And I end up having to rewrite it because there's always an assumption that we don't have Indigenous knowledge in these areas. So every author cited in the draft has been a non-Indigenous person. There's not an Indigenous author, there's not an Indigenous theory, there's not an Indigenous protocol, and yet they want me to do whatever. And I find that so interesting because what we do have is a lot of Indigenous knowledge. We have the CRF, for goodness sakes. We have a whole province. I've never seen a province have an actual cultural responsive framework that the people have actually written themselves. And then the other thing that I get a little tizzy about sometimes is this concept of closing the gap. What gap? There's a gap between Indigenous and non-Indigenous. How's that gap going to close? It'll likely close if non-Indigenous people's health drops. But you're not closing. You're chasing this illusory thing. There is no gap, right? Because the gap is non-existent. If the gap would be, what is Indigenous wellness today and what is Indigenous wellness tomorrow, and measure the change over time. But don't compare us against non-Indigenous health. There will always be a gap, and the only way that's going to change is if non-Indigenous health drops. So let us establish our own parameters for measurement of our health and well-being, and then let us benchmark against that. I got challenged the other day. Someone said, well, you have to know the deficits in order to do the research properly. Do we not know the deficits? Do we not know what's wrong with our communities? I think every study you Google right now will tell you everything that's wrong with our people. So I don't really think we need to know more deficits. Let's be really realistic about that. So the CRF corrects for deficit-based research. I'm not going to go into too many details about the theory because I think you can either read the CRF online or you could grab the article. But why I say that is because it uses trauma-informed strengths-based approaches. So right from there, you're correcting some deficits. It engages a decolonizing approach, which right away you're correcting some deficits. One of the things I said to a scholar recently was, we want no more deficit-based research in this province. Absolutely, there's no reason for it. That's a shock to the system. How many of you kind of have never even heard that before? No more deficit-based research. Yeah. It's a shock to think that you would go into a community and only look for resiliencies, isn't it? How would you do a suicide program? I find it funny. I teach a lot of classes. I teach group counseling, and I have them do a 12-week group, and I always tell them it has to be strengths-based, and then I'll get a title like suicide prevention among adolescent females. Does that sound strength-based? Not to me. And so it takes a lot of reframing and retraining. I've made this mistake. I ran a study with an expressive arts study, yoga and expressive arts with youth, adolescent youth, who suffered trauma. That was the title, a little bit longer than that. And then after I realized that, I thought, geez, if one of my girls in my group heard that title, how sick would that be? That was sick. I don't want them to hear that title. I want them to hear a title that makes them feel proud to be in my yoga group, in my art group, not that they're trauma survivors. So those are the types of things I think we should think about as we ask people to engage with our work, is should we start looking at it from the strengths versus the deficits? And then someone challenged me and said, well, the funding models are the way they are, and they only fund deficit-based research, and they only do this. And I said, really? Because I'm with Dr. Stu Skinner and Ibrahim Khan on a CIHR grant. We just got $2 million to do HIV work from a strength-based perspective. You know what he told me? Well, you're very creative. That's what he told me. No, I'm not very creative. I just know how to do strengths-based research. And it got funded. And CIHR itself has said that it's using the model of two-eyed seeing. So CIHR is trying to unfold itself into a more positive place for Indigenous research. So it boggles my mind sometimes when people challenge me, but yet here's evidence. Also got another $750,000 grant from CIHR with Tarun Katapelli to do TP-based projects in File Hills. So strengths-based again. So I really challenge that notion that only deficit-based research gets funded. I will challenge it every single day. So simply stated, a wellness indicator is a measure of how well we are doing. How we frame the challenge will frame how we look at the solution. By focusing our efforts on tracking progress towards our most important values and aspirations, we will become communities that are working towards health and wellness. So for example, the Muskowgin Family-Based Healing and Wellness Center is not called a treatment center, right? It's called a Family-Based Healing and Wellness Center. And it will get a formal ceremonial name later on. So I'm going to give you some examples of how we engage the CRF, because people often ask, like, well, how do you use it? So for us, I already talked about the Muskowgin project. Muskowgan, we've used that CRF in many ways. We use it as the actual model. So the CRF itself that's on the website of FSIN gives you actual tangible things that you can do to put culturally responsive things in your infrastructure. And then we're also using it in, like it's informing our model of care, it's informing how we do the research, it's being embedded in multiple ways and in multiple areas. I actually use the CRF in one-on-one therapy and counseling. I'm a counselor in one-on-one therapy. How do I do that? I got my client here, I've got me. I want to establish a middle ground right away, a safe middle ground where we're both equals, and then I say, are there any protocols or anything that you need? These might not even be Indigenous people, right? They could be anybody. Is there anything you need me to do, anything about your background that I need to know, anything culturally that I might need to know that would support you on this journey that we're on together? Yeah, in my culture we do this, or I like to eat pierogies, or I like to do whatever, right? So whatever that is, that's the middle ground that I establish. So I use the CRF in everything that I do. I'm going to talk to you a little bit about another place that I use the CRF, and it was in the Nanataway-Wikamik Healing Lodge and Wellness Center. So this was a center that I conceptualized, probably my first year, 2011, when I got hired to be a counselor at the University of Regina, and they took me on a tour of our counseling rooms, and they were these little tiny rooms that maybe 3 or 4 people could fit in that were dark with like 1970s decor, one-way mirrors. I didn't even know people did therapy with one-way mirrors anymore. VCRs and television sets so you could observe the counseling going on, and it was the most insane thing I ever saw. I thought, who would feel culturally safe to do therapy in these rooms? And then no group counseling space. So from an Indigenous perspective, a lot of our therapeutic approaches to life happen in groups. Sweat lodges, sharing circles, like we're kind of circular. So there were no places or spaces. So I wrote a grant with my colleague, Dr. Angela Snowshoe, called The Role of Place in First Nations Health, and that was a SURE-funded grant. And we started to look at the role of place and how that role of place might be important for Indigenous health and well-being. And how could we bring place as a concept into a safe place on an interior, because most of us know for Indigenous people the role of place is on the land. But when we're working in urban environments or we're working in white institutes, how does that play out? How does that look? What does that feel like? So we actually designed our own healing and wellness center and clinic with elders and engagement on an interior inside of a faculty of education. And this was the design concept. So about a few years ago, we kind of came up with that center where the star is would be the group space, and then there's 4 additional rooms around it. Those are individual counseling spaces. And then there's an observation room. So we had this sort of concept in mind. That's the floor. So that would be like what we visualize the seating to look around the group room. And that's actually what it looks like in concept. Like in actual, there it is. However, I don't know if you noticed the ceiling in this picture. It's supposed to be a teepee up there. One of the things that we talked about was, let me just go to this picture. So that's the floor. So these are just the rooms. I could tell you story after story about how difficult this journey was to put this in a white institution. I mean, the sleepless nights and the horror stories that we went through. But I'm going to bring you to this one here. So I had ceremonied for some Tepee Poles about 2 years ago. I went and I interviewed elders about what kind of Tepee Poles would go into our design and what we should do. And I went to Pound Maker, I went to Takakoop. I spent a year on this journey. I come back with my Tepee Poles at the end of summer in the truck that I rented, and I took them to facilities management, and I met them on a Sunday, and I said, here's the Tepee Poles. They look similar to that teepee right there. In fact, it was Mary Lee that got the Tepee Poles for me, so there she is. So they look just like that. And they said, those poles are too small and too skinny. I spent a year ceremonying for those poles. What do you mean they're too small and too skinny? So they put them in storage. I was sick. Then they said, well, we need bigger poles. Okay, well, I'm not getting them. I just spent a year of my life ceremonying for these tamarack poles. So they went on this journey and they got these tamarack poles. And we kept looking at them like, I don't know what you're going to do. I don't know, how's this going to make a teepee? We don't understand. And when we hired the construction firm, we went through a series of interviews with several firms as they do that, like, I don't know how they do it, but they have to bid or something, so we had to interview all these firms. And we talked to them about the protocols of these poles and that we would need our elder there and that they would have to be put up with ceremony. And so finally picked the company that said that they didn't have an issue with that. Perfect. about 2 months before the space was finished, a year ago, March, they went bankrupt. So, you know, it took a while for the university to get itself together and figure out what to do. And evidently what they did is they decided, because there's only 2 months of construction left, they're just going to hire contractors to do the little pieces and parts. And I came home from summer after being on the land with ceremonies to find that in the ceiling when I came back from holidays. And I stood there looking at that. And everyone's like, it's so beautiful. Isn't it beautiful? Oh my God, it's so lovely. The energy of the room is just so beautiful. And I thought, this is horrible. And the white man who put the poles up, he said, what's wrong with it? It's beautiful. And I said, have you ever put up a teepee before? Well, no. Okay. Do you know what a teepee is? Not really. Yeah. Okay, there's a problem here. So I called facilities management and I said, I think we've got a big problem because that's not a teepee. Well, you know, it costs a lot of money. We cemented the poles in, but blah, it's not really much we can do about it. I said, oh, well, I don't really go down quietly, because when I started at the U of R, there was no smudging policy, no feasting policy. I mean, I had to do a lot of work to get those policies in place. It took about 2 years just to do that, and I thought, how the hell am I gonna get these poles down? In the meantime, I started to get really sick, started to vomit on a daily basis. The director of facilities management ends up in the hospital. Like, okay, what's going on here? Didn't cross my mind that because we breached protocol and I'm responsible for this space, that karma, that sort of we pasta win that we talk about, that I guess you might call it karma, you might call it bad energy, you might call it messing around with things you shouldn't be. One of my elders told me in the beginning, are you sure you want to bring in our ways into this place? Is that the right thing to do? Oh yes, yes, it's the right thing to do. So I called the university to task. I said, to the extent that you're willing to reconcile with First Nations people will be the extent to which you're going to get those poles down and the right poles up. And I got my poles out of storage and I started smudging them, and my health started to return. My poles, the skinny ones. And that is now where they are and what they look like. That's the teepee poles that belong up there. I tell this story because, to me, this is establishing a middle ground, you know, in a non-Indigenous space, well, an Indigenous space and in a non-Indigenous space. It's so weird how we've done this, but so we have this Indigenized space and this non-Indigenous university fighting to get what we believe to be our protocols in place. It was a fight, it was a battle. I had to challenge them. I had to hold the strategic plan against them. I had to say, like, you guys say this, but act like this. It's not pleasant. I'm one of 5, remember. I'm one of 5. And I'm also only 2 health researchers. So, you know, while my other Indigenous colleague is great, he's an artist. He's not really on the front lines with me fighting for this stuff. He told me the other day, he's like, I know, he's like, I support you, I have your back, but remember I teach painting. And I'm like, yeah, I know. So he's not on the front lines with us as much. And that's David Garneau, by the way, does fabulous work. I'm not including this so you can see my pretty face. I'm including it because I actually just realized this last night that this is the only picture I have of the door art. So what I have to do is get some professional pictures taken of the art. We actually had Cliff Dubois. He's a magnificent artist, and we offered him tobacco a long time ago, and he went and ceremonied. This is what I love about Cliff's art, and I love about our lodge, is that it is all done in prayer, every element. And if you go back to even now it gets a little bit questionable because those rocks, I gotta tell you, I just have to tell this story. So those rocks, I used to live in Harbor Landing in Regina, which is kind of like one of those pop-up suburbs, and I'm a bush girl, so imagine, concrete slab backyard, you know, just oppressive. So anyway, we told facilities management we want elements of, you know, the elements. We want rock, we want wood, we want this, we want that. And so they came up with what I call Harbor Landing brick. You know that brick that every house has when you're in one of those suburbs? It's that like rectangular dark brick. So that's what they wanted to put up there. And I'm like, this looks like Harbor Landing. I live in Harbor Landing. Why the hell would I put Harbor Landing brick up in a lodge? So Angela Soshu and I went out to the construction company and we handpicked those rocks. And the facilities management person challenged me and she said, this will look horrible, they're too orange, this won't work very well. And well, even though they're not even real rocks, they're actually half rocks, our elders actually thought they were sweat rocks. So I think they look fantastic. And what we did underneath those rocks is we wrote affirmations in all the languages, the 7 main languages from this area, and we wrote affirmations in marker underneath, and then the rocks were grouted. So every aspect of this room has this sort of healing element that just comes through, and you can kind of feel it, and you just know that it's happening and it's occurring. I started to notice that conversations, and because I have the control of the room, like I would just throw a meeting in there and meet with people, and I just started to notice the conversations were different. And they were, so I started to take antagonistic relationships into that room, and one being that after the room was completed, we started to hear from the Faculty of Education. Now, I'm going to just tell you this. I am in the Faculty of Education, but I am in Ed Psych and Counseling, of which there's only 3 of us. So in a faculty of about 54, there's 3 Ed Psychs and counselors, which means that we do research more like clinical psychologists. We get big grants where the Faculty of Education typically, they don't do like big lab research like we do. So I'm already an alien in that faculty, and then you add that I'm an Indigenous woman, and then I'm just like, oh my God, I'm a misfit over there. So the fact that we built a clinic didn't click in their brain that that's something special. Social work would appreciate it, psychology would appreciate it, but Faculty of Education is just like, when do we get to use the room? Well, it's a lodge, it's a clinic. What would you want to do in that space? Well, we want to have a meeting. Okay. Why? Why would you want to have a meeting? Why wouldn't you just go, would you use the Sun Life clinic, the psychology clinic for a meeting? No, probably not. Is it because it's pretty? So we had to start asking our faculty some really difficult questions, and then I started to get challenged. Well, all these resources went into this project, and now we can't use it. Well, how come science has their own lab? Why does drama have their own lab? No one else uses it. Why can't Indigenous people have their own wellness clinic? Why do we have to now fight? So I said, if I have to put up a sign that says this is Indian land, just like they have in my community over in Ontario, there's a bridge that says this is Indian land, I'll do that. So I'm taking them to task. I'll fight for this space, although hopefully they're cooling their jets just a little bit right now. So I want to just talk to you a little bit about what else we've used the culture responsive framework for. I can't take credit for this one. It's at U of S. It was actually the very first thing that used the culture responsive framework, and it's the online module series called The Role of the Practitioner in Indigenous Wellness, and I think it's Stacy Lovogrona, I always say her name wrong, Stacy Lovogrona, her work. So this actually comes out of there, and they acknowledge that there's some challenges with it for sure, but it was the very first to attempt to use the framework. And so we've been working with them on making, changes and strides, but these are the kinds of things that I think that the framework can do and can support. And they have a list of their modules here. So they have all of these online and all of these different ways in which people can just start to learn how to be more culturally responsive. I was asked to keep this open for questions, so I think there's still time. Yeah. So, and I would really like to actually maybe even ask you to tell me what either I or IPHRC or what some needs are that you have too that this framework might help, because I don't like to just talk theory and then leave a room. To me, the application of it is so important, and I think this theory can be used by anyone. So if you just would like some strategic ideas or some basic questions, I'd be more than happy to answer them. And the other thing I just want to put out there is that IPHRC, while back up and running, we are chronically, of course, underfunded, understaffed, and we're working to address that. But think about, as you do research or as you move forward, if you're a student, think about maybe joining up with us. We're going to start offering some research literacy modules, some basic, Indigenous Research 101 stuff, and think about ways that you might want to partner, practicum, be a trainee with our organization to help build capacity. One of the things someone said to me recently is, you need an all-Indigenous team. And I said, no, I don't. And they said, yes, you do. And I said, why would that be? Because I have 14 researchers on my team right now, and I hate to say it, but I don't have one Indigenous. And it's not because I don't want them, it's because we lack capacity. With IPHRC being sort of dormant for 2 years, we have a gap now, because IPHRC used to push those undergrads to masters, the masters to PhDs, the PhDs to postdocs. We've got a gap. So I need more people now. I need people to start working with us again. We basically have to rebuild from the ground up, and so I would ask that if you have those interests that you contact us, but not too fast. Like give us some time to get our legs back, because right now we're just trying to get off the ground. So thank you for listening to me, and I hope that we have some questions that can help all people move forward.
We got one question already. Where is
Oh, how does this work? So our lodge, and my elder, I have to say, scolded me the other day. We were in a meeting with our dean, and we were all calling it the space in the lodge, and she actually was the one, we had offered tobacco to get it named, and she said, why is no one using the name Nanatoy-Wikamik? And we all didn't say anything, and then we said, well, I think we none of us really know how to pronounce it, and she says, that's just not acceptable. I still call it the lodge because it's, I guess, the cop-out and not pronouncing it correctly, but it is on the second floor of the education building at the University of Regina.
My question is more related to your own personal experiences in working with other Indigenous communities. Is that all right?
Mm-hmm.
Okay. You mentioned very briefly about your white-looking face, and I'm wondering, I'm sure I'm not the only person in this room who has been involved in Indigenous communities and essentially been told by the community, oh, you don't look Indigenous enough, or you're not Indigenous enough. Have you ever been faced with that kind of challenge, and how did you deal with it?
Kind of yes and no, but no has never, at least not in Canada, has anyone ever spoke to me like that, ever. I can't speak for First Nations in that way, but that's just not our way typically to speak like that. However, I think that when I was younger, I had more of those issues because I thought I knew a lot, and I'm like, I got this doctorate degree and I'm here to do this, and your problem with your community is that, and I can fix this. And so you learn the hard way a little bit. And also I come from a community, I remember when I started working with the Crees, that I was like, wow, these people are I'm Ojibwe. So I'm like, these people are so easy to get along with. Like, I've really found the Cree people to be really, just bring me right in, where the Ojibways were really challenging. So I called home one day and I was talking to my cousin, and I'm like, man, these Ojibways over here in Ontario are so difficult. It's white people, right? And she's like, well, that's because that's who we are. We're like that. And I was like, no, I'm not. I'm not like that. Yeah, you are. So I realized, oh, yeah, I kind of am. So I think there's just like certain kinds of groups that are more closed off and have the right to be more closed off. But typically when I go into a community now, it's because the community has come to me in some capacity, or we've met in some capacity, or I'm like a Takakoop, I just happen to live there in the summers. So I don't have that issue now. But I think as an early researcher, where I was actually forced to go in. And also one of the things where I was working in the north, I had to learn the hard way that at the time, single woman going into a northern community shouldn't even be making eye contact with males. Like, I had to learn the hard way, and so actually ended up getting adopted by a family in Manitoba, so that I wasn't a single woman going into community anymore. So in that respect, the community wrapped around me to support me to do the work. And then often because of the way I do my work, I don't have those challenges. I go to the elders usually first, and I say, this is what I'm trying to do, and then they'll speak in the language, and then they'll come back, and then they'll tell me what needs to be done. So I don't go in anymore with a preconceived notion or agenda. For example, with Muskowgan, one of the opportunities to build a new build is to possibly put a primary health care unit in. So I work with Stu Skinner, and he's the physician out there, and we had this talk. So I brought it to Chief, and I said, is this something you would want to consider? And he came back, and he said, community wants ceremony before we even have engagement. Okay, so that's what we do then. We go to ceremony, and then if after ceremony we decide to have engagement, then we have it. And if community says, no, it's too Western, we don't want it in there, then we don't do it. And so that's, to me as a researcher, why it probably works, because I just do what community says. But when you talk to other researchers who don't work with Indigenous communities, they would be floored to say, you let somebody tell you what to do or what research to do. It's just not how we're trained in the Western system. We're the leaders, we're the experts, we're this. So I think some of it has to do with, again, how you approach it. And also, I don't just walk into a community. Like I would never go into a community unless I was asked to come in or invited to come in or someone brought me in. So I think those are the things that I've learned over the years. I have a white face, and I often bring in a white research team. And I was nervous when we did our Muskowgan engagement session that most of my team was white, but I didn't have anyone else. And we had 100 people, and we had to do small focus groups. I had to have help and support. And by the end of the day, my team was half adopted by half of the band members. I mean, they were fantastic. And then another story I have is I had two, I don't take people into community unless I trust them, non-Indigenous researchers. But I had two guys in my master's program that had just been phenomenal, and my uncle had met them from a Takakupa, and he said, bring them up to the Sundance 2 summers ago. Bring them up. Let them be Escapios helpers. And I said, okay. I invited them, and they wanted to come. So they came up there, and they were men. So they went off. I didn't see them for 5 days. They did all the prep work. They chopped down the trees, and they built the lodge. And as a woman, I don't have a in on that. And so at the end of the Sundance, when we had our feast, we're all sitting under the awning, and the little cookums were looking at me, and she said, "My girl, what kind of grade are you going to give those nice young men? They better get an A." So I think that when you do it the right way, you just become a part of the community. And they kept, even last summer, my students didn't go, and they're like, "Where are those nice young boys who helped us out last year?" So I think that for me, that's what I try to do, is just build community wherever I go. And I notice that it doesn't matter who you are. If you have a good heart and a good mind, that you will be accepted over the long term. But I think it's a very good question, because I talked to one of my team members on Skinner's team just last night, and she just said, it takes me sometimes 6 or 7 times, and I still haven't talked about the data sharing agreement. And if I whip it out, it's just too much. So that's what I mean by time. And it's hard because grant funders don't care about that kind of stuff. They want the data sharing agreement in place before you can start collecting data. So there's some parameters that we have to work with, and there's some struggles that we have, but we just work through them as we go. But that's a great question. Thank you for asking.
We're getting great questions over here.
Oh my gosh, this is so amazing. So do I read them? Okay, so you mentioned that IPHRC needs to build capacity and that you're looking to partner with others who are interested or engaged in research with Indigenous communities. What can those of us who are interested do to support the center? That's a good question. First of all, be patient with us. We actually only have 2 staff on board right now, myself and our research officer, Amanda Crow. We have a mat leave, Cassandra Wajunta, which we hope will come back in September. And then we have a sick leave right now. So, yeah, we're really understaffed. We are trying our best to we're not permanently funded. We have a small amount of money from Saskatchewan Centre for Patient-Oriented Research, and the NEAR grants are coming out. So we will be writing the NEAR, which the IPHRC was funded by a NEAR grant, a CIHR NEAR, and those grants were removed in 2011, I believe, nationally. Dr. Carrie Barras is now at CIHR and has gotten those NEAR grants back. So we'll be applying for that, and I believe that's 15 years of long-term funding. So we're working on it. But we have a trainee program. That's where I think we could be a strength, is we have a trainee program. We have money for that. So if you're interested in possibly having some of your research funded, if it's Indigenous research on First Nations and Métis people in Saskatchewan only, then we might be able to support you. I think even I'm really looking at possibly supporting end of projects like knowledge translation and mobilization. I think that'd be a quick and exciting way to support. So I have one student right now, for example, who's just doing her master's thesis on the role of place in the school that she works in, and she's kind of at the end, and she wants to write a small grant for maybe $1,000 to get a culture room for the students. I mean, what an amazing way to do some knowledge translation for role of place, and then to build a culturally safe space for students. So that's the kind of things that I think we could help with in helping build capacity. And then patience. If we get 100 people emailing us tomorrow, we wouldn't be able to respond. So maybe like kind of going in around September and checking in on us and seeing where we're at. Long-term relationship building can be challenging given how little universities and funders support this. Any thoughts on how to navigate the system on this front? I don't rely on the universities to do any of it. Ever. It's not about the universities at all, because the universities aren't going to support it, aren't going to sustain it. I mean, I hate to speak for them, and I don't mean to, but I have not seen it at U of R. I mean, everything that has happened at the U of R in terms of any policy change, my lodge being built, any of that is done on my effort and my initiative and the relationships that I've built with community. So if you're waiting on your universities to do something, you're going to be waiting a hell of a long time, and you might get something infrastructurally in place, and then the next leader comes in and it changes. So, I mean, I told you I speak the truth, right? I'm not here to mince words. I'm not here to play games. I have tenure now, so I have some protections in place. Like, relationships aren't about who is allowing you to do it. You just have to do it yourself. So start small. If you know that there's a problem and there's some First Nations people that need some support, start there. But let me just, I'll say this like I say it in all my counseling classes. You can't go out and do reconciliation work if you haven't reconciled in yourself. So one of the first assignments students have in one of my counseling classes is some kind of self-analysis. So if it's multicultural healing, they have to look at who they are as a cultural being. If it's counseling girls and women, they have to look at how they've been gendered as a male or female growing up in society. And usually the first response I get is, oh my God, I'm 30-some years old, I've never looked at myself. Well, don't be in a counseling program then, because you're asking others to look at themselves. So you have to really know who you are. And if you don't know who you are and where you stand and where you sit with either your Indigenous side or your settler side, I mean, how many settlers have Indigenous people in their families? Understand that. Can you reconcile in your own family? If you can't reconcile in your family, you may not be able to do much at your university. So those are the kinds of things I would really question you to think about your own self in relation to these things.
So we've got about 3 minutes left, and we've got one question.
Have I been talking for an hour?
You have.
I was so
And we've
scared
loved
I would
every minute
never
of
be
it.
able to fill the hour. It's amazing. So how do you do this? Do you take a person or you take a... Okay.
Hello.
Hi.
Thanks very much, Jolie. It's a very nice presentation. May I first introduce myself to you, because it sets a background for the question. I am a Vice Dean of Research in the College of Medicine, and I am concerned in my office with research excellence. We strive to be better and better in research. Now, if you take the 2I approach and you look at the research and research excellence, the first I, Western I, is relatively easy to define, and we'll be concerned about the money we raise, we'll be concerned about the number of publications, we'll be concerned about the number of citations, age factors, etc., etc. But when it comes to the second I have a problem to understand, and I have asked the same question to many of my colleagues and friends. I was trying to tease Malcolm King yesterday during the meeting, and I want to tease you with the same question. So if you would like to offer a lens, indigenous lens on research excellence, what elements you would say are the most important ones? What should I, as a Dean of Research, consider in evaluating the colleagues who do the indigenous research?
My first thing would be, how does it benefit the communities? So if you're doing research, then you should ask the people that are, well, I don't like to say the people being researched. I bring them in as co-researchers, and I would say, what benefits you?
How would you define this one?
They would define it.
They would define it. So you would need to ask the community, how do they view the impact of the research in their everyday life? That would be your main criteria.
Absolutely, because we've been so exploited for so many years and over time that if that benefit doesn't come back to community, there's no point in you being in community. I'll just give an example. There was recently an HIV researcher not from the province trying to come into community. She declared that she had 7 years of this engagement and that she was ready to come into Saskatchewan and do this HIV research, but she was talking about using rabbits. She was talking about using rabbits, and she was talking about using gorillas, and she was getting her gorillas from Africa, and she was getting her rabbits, and then at the end they would be injected with all this stuff, and then they would be euthanized. And I said, if you actually had engagement, you would know that our communities would never sanction the euthanization of animals or even the use of animals without first having a conversation about it, and then perhaps a ceremony. I mean, I don't even know if we would get to the point of ceremony, because I don't know if they'd ever allow it anyway, but to the point of ceremony at the end if you are going to euthanize these animals. On my reserve, we have a dog catcher, and if the dog catcher puts down a dog, he uses ceremony. So again, I go back to what's the benefit to community, and if there is no benefit, as much as it's hard to hear, get out.
So I understand, so there's no other criteria. The benefit of community.
Well, that's
is
the first
only one.
criteria. If there's no benefit to community, get out. You have no business being there.
Suppose that there is
I'm sorry, I didn't hear that part.
suppose that there is a benefit to community, and I completely take it. I'm just looking for a guidance
Yeah.
in this one. What would be your point 1A, 1B, 1C? You know what I mean? I am trying to find...
To understand OCAP and to hold yourself and your research team for the OCAP empowerment of the people that you're working with. So for example, if you go into a community and you're doing, I don't know, you're collecting X amount of data and the community doesn't have capacity to own the data, maybe they don't have the infrastructure or they don't know how to do the analysis, then I would be asking your research team to create an empowerment plan, probably in partnership with like an IPHRC that says, we're just gonna offer research literacy modules, we're gonna do this, we're gonna find a research information officer in the community. I always look for someone in the community who wants to join my research team so that they can be empowered. So right now at the Muskowgin project, I have Fred Osup, who just graduated undergrad, and I'm trying to offer him a contract, and I'm trying to push him to masters. He doesn't know this yet, but you know what I mean? It's that kind of stuff. It's like, get those people on your team, get them empowered,
Sure.
because eventually those youth should be coming into your med school.
Would it be any proxy factors by which you would define that there is a benefit for community? Or only direct relation from the community is the one that you would say is the most important?
Yeah, because
and
if the
only
community
one?
doesn't see a benefit, there's no point in being
Okay.
here. Yeah.
Thank you very much. Thank you.
Okay, we're going to allow one more question from the floor, and I'm afraid we've missed some of the questions from here, but are
sorry.
you with us for a while?
Yeah.
Good.
Hi there. I'm wondering about when you don't have these kinds of infrastructure to make this beautiful space, particularly with like the counseling you do and that kind of work. Are there like tangible examples of how you open up space for kind of the traditional and the cultural and those things to be upheld and respected?
Well, again, I go back to and when I say community, I'm not necessarily saying, you know, a First Nation community or Métis community. Go back to the community of which wants the space. If it's a faculty, what do they want? If it's, like, you have to go to the place or space of the people that surround it, whoever those people are. So if you want to put in a culture room somewhere, then ask the people. Right? And my go-to are elders. Like, to me, that's the most knowledgeable that you can have. And if ever you can put elders and youth together, I would do that, because that's where that knowledge translation needs to happen before our elders are passing daily. Like, I get calls like once a week that an elder's passed in my community. So I would say, like, get some elders, get some youth, and figure out where you are and what you want to do. But, like, again, I just go back to, if you're an ally and you think it's great, it may not be. So don't like just jump on board and do it and then be like, oh, why isn't this working? Like, consult with Indigenous people who would use it or who would want to have a say in it before you make those decisions for us, and then we don't use whatever it is that was done, because a lot of resources get wasted that way regularly.
I am really
Sorry,
sorry
there wasn't more time.
to break this conversation, because it's been fabulous. So I can't thank you enough for being here. And please stay with us and continue the dialogue. Thank you very much.
Thank you.
Thank you.